an I-team investigation into a Watertown nursing home where there have been hundreds of calls to 911. Reports from first responders alleging neglect and possible abuse have now been sent to the district attorney. Sources tell Chief I-team investigator Cheryl Fiandaca that a criminal investigation is now underway.
I'm sorry I get all emotional.
Looking at these photos of Jean Donnelly's face brought tears to her daughter's eyes.
It was horrific. She had a huge gash on her forehead, like a golf ball, and her whole face was bruised.
It happened in March. Jean has dementia and was living at Vero Health and Rehab of Watertown.
I saw my mom. I said, call the police and call ambulance right now.
When the police got there, that's when a nurse came in and said she has a history of hitting herself. And that's not a history that my mother has.
Police, concerned about possible elder abuse, forwarded Jean's case to the state and the Middlesex County District Attorney.
The state has to step up. People have to be responsible. You're taking care of our parents.
Sources say prosecutors are now investigating Jean's case and several others. The I-team has learned between 2019 and 2020 there were 272 calls to 911 from the home, some made by the residents themselves. And the reports of those alleged incidents obtained by the I-team reveal a troubling history
59 Coolidge Hill Road, Vero Health.
That includes firefighters finding an injured resident alone, lying on the floor, asking for help. When asked why no one was helping him, the woman in charge laughed.
Unresponsive party, not breathing.
And after getting a call about a patient's ventilator not working correctly, firefighters found none of the electrical outlets were working in the room. And just recently, first responders called for a patient having difficulty breathing, saw staff members performing CPR on the man who police believed had been deceased for several hours.
We're at a bad state and time for people living in nursing homes.
Attorney David Hoey practices nursing home law. He says with the state halting annual inspections of nursing homes during COVID, there's very little oversight.
And there's no enforcement for what's happening in the nursing homes.
Documents reviewed by the I-team found the state recently cited the facility as deficient in COVID-19 infection control. And Medicare surveys called the overall quality of care below average.
It was the worst thing we did, was put her there.
Mom, what are you doing?
Jean's family is now demanding more be done to keep long-term residents safe.
These people don't have their families visiting. God knows what could be happening.
We contacted Vero Health and Rehab, which runs 8 facilities here in Massachusetts. A spokesperson told us it does not comment on operations or facilities. Cheryl Fiandaca, WBZ News.